A 17-year-old woman now, a different story totally, is admitted to the hospital with right lower lobe pneumonia. She has history of prior pneumonias and multiple admissions to the hospital. She also has a chronic daily productive cough as well as chronic diarrhea. And let me tell you a little bit more about this because this is important here. The chronic daily productive cough, she says it's very productive. It's foul smelling, it's greenish looking, and then you say, well, how much is this? And then she says, she points to, a cup of glass. She says, yeah, I fill that, every day plus, another half glass. So very productive cough, foul smelling, greenish cough, not the typical one that you get with chronic bronchitis. People with chronic bronchitis have productive cough, but they don't produce, it's not so productive that they could measure it like these patients do. It's not foul smelling like these patients. And then, along with that, she has chronic diarrhea. So this is important because, where's the chronic diarrhea coming from? She seems to have something in her lung, but why is she having chronic diarrhea? You examine the patient, she's thin, she's in respiratory distress, her lung exam shows diminished breath sounds on the right lower lobe, and what she has is this disease called bronchiectasis. Now, if you compare bronchiectasis to emphysema, it's kind of like the same process. Patients with bronchiectasis have permanent dilatation of the bronchi, but it's above. It involves the small and medium-sized bronchi. So if you think about it, emphysema involves the terminal bronchioles to the alveolar membrane. So bronchiectasis involves the small and medium-sized bronchi. And there's two types. There's one that is diffuse because there's a systemic factor involving these cases, and the other one that's local because they've had an old pneumonia that's involved this area. And I'll explain that a little bit more. The systemic processes that cause bronchiectasis, think about the lung fighting off infections. It has a couple mechanisms to do that. It has immunoglobulins, it has the cilia, right? The cilia move, and you get rid of microbes and stuff like that. And then you have the cough. Those are the three basic mechanisms that the lung has to basically fight off microorganisms and infections in the lung and so forth. So if a patient has a problem with one of these three mechanisms, then the whole lungs get increased infections. And what does that? What would be systemic factors that would do that? Things like cystic fibrosis, where these patients produce these very thick cough that kind of block their bronchi, right? So they can't get rid of microorganisms with their cough, process, or people with cilia dysmotility syndrome, where the cilia is not working well. And some of these patients, not all of them, have dextrocardia, and this is called Cartaginer syndrome. But basically, the cilia dysmotility is what affects the lung. And then the third one, people that have immune globulin deficiency, like IgG deficiency. So think about systemic